so much for joining us here on People Helping People.
Good morning to you.
Great. Today on People Helping People, you're in the hot seat. And the hot seat where you hold the responsibility as county medical officer of health. And this is under the health systems and policy, right?
Well, under the Division of Health and Social Services.
Right.
Yes.
Good. So, ideally, you would be the person that will be able to help us find answers about Zika or battling Zika, I would like to call
Well,
it.
we could try. We could try together.
Right. Ideally, through this segment, what we would like to do is, in People Helping People, ideally, people, you're the person going to help other people, find out, okay, this is the reason why this might happen, or these are the places I can go and stuff like that. So let's start off about Zika. Let's talk about Zika. You explain Zika. I want you to answer that question. Let's talk about Zika.
Okay, so it's a mosquito-borne virus spread by being bitten by a mosquito that is carrying the virus. It's the Aedes aegypti mosquito that is the primary mosquito that carries it around. We do have Aedes aegypti mosquito in Tobago, so we are at risk. It's not understanding the mosquito and understanding the virus is sort of very similar. Okay. So understanding the mosquito is a good starting point.
Right.
The mosquito is not only a night. It's not really nighttime only. It's day, night. It's an anytime biter. So it can bite you during the day. So you're at risk anywhere, and we are all at risk. And that's a really good place to start. That we are all at risk, even if you don't see the mosquito around your house. Does not mean you're not at risk. And that's a good place. That's a good,
like even now during this interview, if there's
exactly.
a mosquito here.
But we would we'd like to think that we don't have mosquitoes within the public health services
Right.
department. but no, you're right.
Yes.
Right. So you could be walking down the street, you could be in a store, so you're at risk anywhere, anytime, and we are all at risk.
That is an important factor to know, because usually through the advertisements you would hear bushy areas, the areas that are this, the areas that are that, and ideally mosquitoes can be anywhere.
Yeah, and there have actually been studies done on where we find the mosquitoes in Trinidad living, and the late Professor Chedi did a lot of work out of the University of the West Indies looking at where we find these mosquitoes.
Right.
And they've actually been found that most of them are in and around where we live, meaning inside our homes. The bedrooms, the living
Everywhere,
rooms.
yeah. Actually, I agree to that. I've been invaded recently. But it seems to be, I'm hearing so many persons talking about that, I want to call it an invasion, because sometimes you might be standing somewhere and you feel something on your leg, then you feel something on your hand at the same time, then you feel something on your face. So to me, that's invasive. And usually you don't have that amount of mosquitoes at once in the past, I would have said.
Remember, we're coming into the rainy season, so that's
Right.
one thing. So maybe there's a noticeable change in the mosquito population. I'm just saying, perhaps that there is. But to counter that, I would say, so part of what we do is we would measure mosquito population.
Right.
Now, mosquito population, the amount of mosquito, the size of the mosquito population really doesn't tell you how many persons are going to get Zika or dengue.
Right.
It just tells you the size of the mosquito population.
What is the population?
And when we measure that for Tobago, so it's measured by an index as a proportion. And when we measure that for Tobago, it's really low. So our mosquito population is low. It's below the levels of what we would even recommend countries to target for.
Right.
Ours are below that. But that is not to give us a false sense of security.
Right.
Because you really just need one mosquito bite.
Absolutely.
Okay.
Give us an idea of the population and what the population.
So it's a percentage. So we say
Right.
below 5%, and most of the areas in Tobago are below 5%. Some are as low as 2%. So that's how the population is represented.
And if you can, I don't know. So can you equate the percentage to a
Number?
figure?
No,
To
no,
number?
no, no.
That would have been
And that's what, well, it
Yeah.
would have been. I mean, I can't do that now,
Yes.
but it would have been, and it would have been. But the idea, though, is the takeaway message on that discussion point is that the mosquito population on the island is low compared to what the standards are recommended for mosquito populations
Right.
for you to take action. So if you had a mosquito population of more than 5%, then you would want to make sure and have
more
an aggressive
action.
exactly.
Understood.
So right. So that's the take-home message on the mosquito population. The other message is that one mosquito is all it takes to be bitten to get a case, to be
Right.
infected, and especially that one mosquito being infected with Zika.
What are the types of mosquitoes we have here in, well, I would say Trinidad and Tobago, I'm not sure if to say the Caribbean.
Well, the primary focus for the mosquito-borne diseases is the Aedes aegypti mosquito.
Right.
We do have the Culex mosquito, and there's been discussion around the potential of the Culex mosquito spreading or transmitting the virus. But the primary focus is still the Aedes aegypti mosquito, and all the eradication programs, the elimination programs,
Yes.
the things that we're trying to get. You talk about people helping people.
Yeah.
We helping ourselves, we helping our neighbors helping us. So part of that is the big drive there is the Aedes aegypti mosquito, because that is a mosquito that transmits the virus. It is the mosquito that lives where we live, and it is a mosquito that bites us because it needs blood.
Right.
But you had asked a question about coming back to what is the Zika.
Yeah.
And we started by saying understanding the mosquito helps
Yes.
you to understand, right?
Yes.
So we
So
understand the
let's-
mosquito in terms of where it bites, when it bites, who bites. It's a female mosquito that bites
Right.
because requires blood
Right.
for its eggs.
That's
so
all. It's a part of a reproductive.
reproductive cycle of the
Right. That's
mosquito.
interesting.
Yeah, so it's a female mosquito that bites. How important is that? Maybe not to you and I, because
No,
we
it
can't.
doesn't, actually.
Yeah, we can't say, oh, this is a female mosquito,
Yeah.
right? But it is important from the clinical side of it to understand how the population is moving, or if you want to target to reduce the amount or the Aedes aegypti mosquito. But it's still important. Some people might be intrigued by that. That is the
Yes.
female mosquito bite. The other thing, now shifting now to the disease, the virus. How do you know when you've had Zika? Some reports or data coming out of the Pan American Health Organization, World Health Organization, have shown that if you have 4 persons who are infected with the virus, there's a chance that 3 out of those 4 persons will have no symptoms.
Right.
And that's something to really understand. 3 out of 4 persons, and this is not just 4 persons in a room, this is 4 persons with the virus. Only 3 will not show symptoms, only 1 will show symptoms. So it's supposed to be a very mild infection.
Right.
And not many persons, and a smaller proportion or smaller amount of the persons who get infected will show signs and symptoms. And what are the signs and symptoms?
Tell us.
Rash and red eyes,
Right.
and fever, joint pains, body pains. Those are the primary, the main distinguishing feature with the Zika virus we've found in the region is the rash and the red eyes.
Yeah.
So, and then comes the fever, the body pains. And fever is not really a really high fever like with
Right.
dengue, it's a lower fever.
So if someone is
And it's a
experiencing
generalized rash, may or may
yeah.
not be itchy,
Yeah. Okay. Because
goes away on its own.
Right. I was now gonna talk about that because
Yeah.
you're hearing about this rash and this Zika strain and these things that are going around. Some persons are, having some sensation in their hands, and they're saying, "Oh, what is this? So probably I have the Zika." So every little thing that is happening now, persons are linking it to Zika because Ebola is out of the way. So
Yeah.
Zika is here, it's prominent, and these things are happening. I'm not sure if you would be able to answer some of these different things that are happening with persons, because I remember going to the drugstore and a lady came for a rash, and the pharmacist responded and said, "What is this rash? Everybody's coming," and she didn't have any more of the cream that she literally sold probably close to 100 of the cream, because she had 100 customers coming with a rash.
Well, so the rash with Zika will disappear on its own.
Okay.
And that's something that that
Need
if
to note.
you need to note, because you may go out and purchase an ointment or a cream, and
Yes.
it may not be for the rash that you have.
Right.
So the rash with Zika disappears on its own. It may be itchy. You may get medications to ease the itching, but
Right.
it resolves on its own. And I've heard, we've gotten reports too of this rash, and among my colleagues, you'll hear them talk about the rash. We have not been able to say whether this rash is. We do know that there's Zika, and that Zika presents with rash, and it's one of
Yes.
the main ways it presents. And we expect cases to rise
Right.
as we become more and more aware, and more persons and becoming infected. Whether the rash that they are reporting is a Zika rash or a non-Zika rash, I can't say that.
Right.
But it's, I mean, given that Zika is in the environment, it could very well be that we have Zika, and those are the rashes that we are seeing.
Right.
Flu season is also coming up.
Right.
So you may find that some viral illnesses will present themselves with a rash.
Okay.
Yeah. So because the Zika virus, dengue virus, they are all viral illnesses, and,
Yes.
and so rash is one of the ways that viruses can
And
present.
dengue is also transmitted from
The same
mosquito.
Aedes aegypti,
Right.
same way with chikungunya, same Aedes aegypti mosquito.
One of the things I'm very curious about, being who I am, I wonder how the whole process happens. What sparked an idea in my mind just now when you spoke about the reproductive system with the mosquito. How do you determine, okay, this is Zika, this is dengue? How, based on the symptoms, how does that happen?
So I will answer that from two sides. So there is the laboratory, a test that will confirm. Actually, that's a very good question. It's a good question that we reason why you ask that question, because we would like to know a name. We like to know what it is I have. We like to know a diagnosis,
Of course.
right?
Yeah.
With Zika, there's one laboratory that's approved to test for Zika, and that's the Caribbean Public Health Agency.
Right.
And they do all the testing for the region. So when you go to your physician, your doctor, and he or she says, well, based on these symptoms, and that's why the rash and the red eyes are the real primary symptoms, we think this is Zika. He or she may choose to take blood from you.
Right.
And now because the entire region has to be supplied by, or CARFA has to provide this laboratory testing service in the entire region, and there are not unlimited resources. Resources are limited. So we have to now they've come up with a way to triage, to prioritize who we test and who we don't test.
Right.
And it really is based on who is more at risk. So you find that's why the pregnant women, we always test. We will test someone who is pregnant, presenting with signs and symptoms,
Right.
because of the risks associated.
Yes.
All right. So there are criteria for who will be tested, and there are some, like, for example, if I go, because I don't fall into any of those criteria,
Right.
so I wouldn't be tested. But because we know there is Zika present in the country or on the island, and these signs and symptoms are similar to that, then by association, for want of a better word, this is Zika. And there's no need to get a confirmation test, because the confirmation test doesn't help to change how it is managed. But you and I would like to know.
Yeah.
And so sometimes we've heard that there are private laboratories that are offering this a Zika test.
Right.
It's not proven to be correct or reliable or accurate.
Yes.
And so that's helping people. One way I can help is say, the value of going to a private lab for a Zika test is there's no value in it to you, because your results are not validated. The results are valid, they're not correct. The best bet in terms of getting an idea as to whether this is Zika or not is your doctor,
Right.
your healthcare provider, and you can go to them at the health centers. And they are the ones, because it's really a clinical diagnosis, signs and
Yeah.
symptoms.
Understand. So another question popped into my head.
So you ask how just to finish how it
Yes.
happens.
Yes.
So when the sample goes now, the blood sample goes to the Trinidad Public Health Laboratory.
Right.
It is then sent from there to the Caribbean Public Health Agency, and they run this particular test on it, and then the results come back to us and say this is Zika positive or Zika negative.
Understand.
And with regard to strain, I mean, so far there's only reports on one Zika virus type that we have. So the strain discussion may be, I don't think it's of value in the Zika conversation.
Just probably persons becoming paranoid by.
Well, we're concerned,
Yeah.
right? We're concerned because of
Yeah,
all that is
paranoid
coming
was
up.
a little harsh. Yes.
Yeah.
Concerned. Right? So remember the rash that you're seeing and the red eyes that you might get separately from not having. So sometimes all these things can happen separately, or they can happen. If they happen all together, well, it's definitely Zika.
The rash and the red eyes, in most of the cases, the rash and the red eyes have been happening together. One may
Okay.
start first, but soon
Yeah.
after the other one
So
develops.
if in this instance where persons are getting the rash only,
Well, hardly likely because it doesn't meet the criteria
right. So
for
if
it being
someone gets
Zika.
red eye only,
But there are other causes of red eye,
true.
right?
You know
And that's
how
why we talk about
people
a
get
case
concerned.
definition.
Right.
So in our language, in our science, we'll talk about a case definition, which is not just one sign or one symptom.
Right.
It's a collection of signs and symptoms that tells
is
if
it.
you have these, you have the greater chance or greatest chance of this being
Right.
Zika, and that's what we go by,
Right.
and the clinicians go by doctors go by that.
Great. So tell us, Dr. Partap Singh, tell us what is one to do? What are some things that we can do at home? What are some things we can do individually? What are some things we can do collectively in battling Zika?
Because we're all at risk.
All
we
at
all
risk,
have to.
even right now.
Yeah.
What can I do right now?
Mosquito
while sitting
repellent
here?
right now. Long sleeve clothing right now.
Excellent. Well,
Light colored clothing right now,
Right
because
now.
these things that repel, that protect you against the mosquito when you're
Right.
outside. If you're going to bed, under a bed net or screens over your windows. If you're sleeping with your windows open,
Yeah.
or if you have the air conditioning and well, it's still to be under the bed net because you open the doors to get in and out of your room and you don't know a mosquito could come in.
Yes.
Right? So mosquito bed nets, and then even with the bed nets, you be careful. Take note of that it's tucked well
Yeah.
under the
because
mattress.
you don't want to trap a mosquito
Inside
the
your
net
bed
with
net.
you.
Yeah. And then you want to know, there's some easy tips. So for example, if you sleep on the left side or the right side of the bed, you want to leave the opening on the net on that side of the bed.
Right.
Some of the nets have a lace on the opening so that you can know that is the opening, so you're not in the night trying to scramble to see where to get out of this net, and you and the net come down together off the ceiling one time together. So those are
Right.
tips to make it
Yes.
easy, because it's amazing how those things really make us feel, this is cumbersome. I am not doing this.
Yeah.
Yeah?
It is. It
Yeah.
is, when you see a mosquito net, you remember long ago when you grew up with your grandparents. So, but the thing is, it's a necessity.
Yeah.
Especially in the time of Zika, dengue,
Yeah.
and all these different diseases.
Yeah.
Viruses.
So mosquito repellent with at least your 20% DEET, and
At least with your
20% DEET. You have to look at the instruction, the ingredients.
Okay, what is that?
So that's the active ingredient that has been found to be useful to
Right.
repel or to protect you from being
Okay.
bitten by mosquitoes.
What about citronella? What would you say about that?
I remember reading. So, if you go to the Pan American Health Organization website and the CDC website, there's a listing of all these chemicals, all these agents, and it gives you advice as to which has been shown to be useful and not useful. I don't think citronella was shown to be useful. Yeah, that's why the DEET is the recommendation,
Okay.
right? And it's very interesting when you read and which ones are useful, which ones are not useful.
Yeah. So
Yeah.
where do I find this information, or where can persons
PAHO.org, www.paho.org,
Okay.
PAHO.org, or I think it's CDC.org, CDC.org.
Right.
And if you look at patient information, there are loads of patient information brochures. They have search boxes. You could search
Yes.
mosquito repellents
Yes.
and DEET, DEET.
Right.
So you may come up with the articles that tell you
What
about
about
it.
the persons who don't have the internet? Tell us about some of. Right, you were going through some of them. So we spoke about the citronella and the percentage of that.
The recommendation is DEET.
The
To
recommendation
find
is DEET.
an agent, find a mosquito repellent that
Yes.
has DEET in it,
Okay,
right?
excellent. So
And your pharmacist will definitely be able to help you with
help
that.
you as well. So we spoke about
Mosquito
the-
repellent, mosquito net, and now the big one,
Tell us.
source reduction. It's a fancy word. It sounds fancy, you know.
Source reduction.
Source reduction, meaning reduce the places or
Yeah.
the sources where these mosquitoes could
Yeah.
choose to breed.
Right.
And that is emptying the saucers from the flower pots.
Right.
Don't even use them.
Yeah.
Turn them over. The vases with the water, don't put water. Fill it with something else, soil or sand,
Right.
if you have something holding it. The empty containers. And coming back to that research, that study, the research from Professor Chady, late Professor Chady, what he was able to show was that the greatest sources of breeding sites for mosquito breeding in and around the home is those containers that we use to collect water for our use.
Wow. Even rainwater. Yeah, that's a question I wanted to
Yeah,
ask.
even rainwater.
Wow.
Because because it's clean water,
Yeah.
and the mosquito likes to live in those and breed in those areas.
Right.
So the buckets, the barrels, the jalitas with water, and even if you have your barrels, it's not like the idea is not to don't have these water collecting containers, but secure them properly. Cover your buckets. Don't leave it exposed so that the mosquito could fly in and then you go, oh, I forget to cover it, and then you come back and cover it and the mosquito is still there. Or your barrel, you have the mosquito nets.
Yeah.
They have covers for the barrels, or you have the mesh, and you want to make sure that the mesh doesn't droop down into the water, because then that defeats the whole purpose.
Yeah, totally.
Right.
I'm just
So
seeing it
yeah.
as you
So those are the things that because using the evidence, using the data that we've found on where these mosquitoes are. These mosquitoes are in these types of water collecting containers.
Right.
So cover those containers. Put your meshes over your barrel if you don't have a cover over the barrel. Check them regularly to make sure that they are secure.
Yes. And even when changing them, you make sure you scrub it.
Yeah. Because the eggs could be attached to the sides there, and so your scrubbing removes the eggs if there are any.
How long would those eggs stay in
They
there?
could remain for a very long time. Even if they're dried,
Yeah.
they can remain for a long time, and when they get contact with water again, they can hatch. So that's why you want to scrub them and run them off, wash them down the drain.
Okay, interesting.
Yeah.
So let's talk a little bit about the division and some of the things that the division has been doing or are doing currently in battling Zika. Briefly, of course.
Well, when I think it's 2014, I think is when we first got word, the region first got word that Zika was present in Brazil. Correct me if the year is not 2014, but it was from that very first introduction that the region was made aware. The division started in educating the clinicians. That was the recommendation by the Caribbean Public Health Agency at that time. Start to inform healthcare workers on what are the signs and symptoms so they become aware of it, and we did do that. So we've been doing that for a long time, and so the target was the healthcare workers. When the cases started coming on, we started to have the campaign. We went out into the health centers, we went out into communities. There were meetings that we were at, and we would give a little 5-minute, 10-minute presentation on Zika. We printed brochures. There was collaboration with the Ministry of Health in terms of getting those brochures and those posters and those banners up and going. So that's what we've done from the education side, sharing the information, getting information out. We would communicate with the media. We'll share with the media as the cases were evolving, the number of cases.
Right.
We can't, share confidential information, but we can share a number of cases and so forth.
Right.
And then the vector work, to control the mosquito vector, that is work that has been ongoing. I talked to you about the measuring of the population.
Right.
That's one side of it.
Right.
The other side of it is the breeding, to control the adults, so to spraying for the adults, to do source reduction in the home using the perifocal workers, where they come into the homes and they will look for your breeding sites. They'll tell you, well, this is a breeding site. They will destroy those breeding sites, empty the containers, or they will put chemicals into the waters if you have that will kill the mosquito larvae.
Right.
And so that work has been ongoing.
Okay. Excellent.
And it comes back to the evidence driving the work. And the evidence is that the breeding sites, those that contribute to disease, are the ones in and around the home.
Right.
Tires are not the primary, have not been found to be a primary source of
Right.
of the breeding sites.
Not even with water.
But they are, no, you see, this is where with water, they will be breeding sites.
Right.
But when you have to pay attention, if we have to divert or devote our attention or efforts, you want to go to where you get the biggest bang for your buck.
Right.
And the biggest bang for your buck is the water containers in and around the home.
Okay.
It doesn't mean that you have a now allowance to keep the tires, because you know that the yellow fever regulations have now been amended, so the fine has been increased.
Right.
And so there's a drive now to actively enforce this. So all breeding sites around your home, you could be charged
Yeah.
for all breeding sites.
I think it's very important because when you see the possibilities that exist, or I don't even want to use possibilities, but how detrimental the
Yeah.
Zika, the virus, can
Yeah.
become to an individual or even to a pregnant mother.
Yes.
I don't want to ask that question just yet about the linkage with the baby and stuff, because I'm not sure if it was proven that
Well, the evidence supports it,
The
right?
evidence
So,
supports it,
so it's
okay.
not, whether it is cause and effect or associated with,
right.
it has been found that among persons pregnant women with Zika, there's a greater chance of the babies being born with microcephaly, and not just microcephaly,
Yeah.
microcephaly and other neurological disorders or effects.
Right.
So it isn't, and microcephaly, when babies are born with a small head, it's reflective of the brain development.
Yeah, the neurology
Right.
aspect.
And that means if your head is small and your brain is small, then your ability to develop
Yeah.
your skills to function as an adult
has also been
minimized. And those are the longer term challenges.
Yeah. Interesting.
Yeah.
You mentioned something a while ago about the adult mosquitoes. I know you're excited to talk, and that's great. I love to interview persons that are passionate and understand.
I hope I don't forget that thought.
That's
The mere
okay.
pressure to not forget it might cause me to forget it.
You remember it, but tell me about you said the adult mosquito and what's the lifetime like for mosquito, if you could answer that question, of course.
I think it's a couple months.
A couple months. So what would you determine an adult mosquito? Yeah, you said so the crews go out and they deal with the adult mosquito.
Meaning the ones that fly around.
Okay, so
Yeah.
the larva is the baby and then...
Yeah, the larva can't
Okay.
fly.
Right.
And the
sure.
eggs can't fly. So it's the ones that fly around.
Okay, good.
A
That
little
was-
demonstration.
Yes.
Fly around.
Lovely. So the thought that you wanted to share
Oh,
with us.
right. So the other effect was what they observed with adults, non-pregnant adults, and Guillain-Barre
Right.
syndrome.
What is it?
Guillain-Barre syndrome.
Tell us about Guillain-Barre.
So Guillain-Barre syndrome is a collection of signs and symptoms that can result in you having difficulty breathing. So it affects your ability to breathe, your muscles. So, and what they found is that Zika has been associated with an increase in Guillain-Barre syndrome in
Right.
adults.
In adults.
Now,
Interesting.
yeah, so it's something to become aware of, because
Yes.
it's the other side of it's not just, you see, that's why I say it's
Yeah.
not just few people
Yeah.
at risk.
Yes.
Everybody,
Everybody's
everyone
at
is at risk
Yeah.
in some way or the other.
And with regards to the Guillain-Barre syndrome, is that something that can be cured? Is it something that would last a long time?
Well, some person, it requires hospital management,
Yeah.
because you have to be managed in hospital. There are medications that are used for it. The medications are expensive, but you can survive from Guillain-Barre syndrome. Some persons can have side effects or lingering effects from it.
Right.
So it's cause for concern. It's cause for you to protect yourself.
Right. So guys, protecting yourself, that slogan doesn't only go with sexual intercourse.
I know, right?
So we have to protect ourselves now from mosquitoes and be aware of the things that we can do, the things that we can help others with as well. You know, keep your environment clean, wear long sleeve clothing, light clothing, get the repellent that has DEET.
DEET.
DEET, right? And you can check out pahu.org as well as patient information.
No. pahu.org or
Yes.
cdc.org or even carpha.org, carpha.org. And within there, look on their search boxes,
Yeah.
search for patient information, or
Yeah.
just search Zika, search mosquito repellent, search DEET, and you might
Right.
get some things. Those are more the reputable places to get your information from.
Excellent. And then, of course, you can contact the division.
You can contact the division, you can contact the health centers, you can contact the public health services department.
Do you have any numbers to share with us?
Well, there's 639-3751, which is the office number here.
Excellent.
That's a good place to start.
Lovely. So utilize your internet well, your online search, do different searches, try to find out more about these things and how we can help ourselves, how we can help our neighbors, how we can help each other, and how we can help our future generation. Thank you so much for joining us.
You're welcome.
Dr. Partap Singh.
You're welcome.